Joe Freudenberger, CEO for OakBend Medical Center in Richmond, Texas, coming to you today with a cup of Joe. We're going to have a conversation about healthcare topics. Lots of stuff to cover in the healthcare space that, unfortunately, there's so much that there's a lot we don't know. I'm joined today by Dr. Juan Sanchez. He is one of our family medicine residency. He's a member of our family medicine residency program. One of our residents that joined us last July has now completed his first year in our residency program, and we've invited him in to test out his skills to explain something that's really important to us, which is chronic disease. July 10th was Chronic Disease Awareness Day, and I think it's a good time to get out here and talk about chronic diseases and what we can do about them, et cetera, et cetera. So, when we talk about chronic diseases, what does that mean in layman's terms? I think I know, but I'm not sure. And what are some of the most common chronic diseases that people are living with today?
Some of the diseases that we see on a daily basis can be diabetes,
Okay.
high blood pressure,
Okay.
kidney disease,
Okay.
heart disease, pulmonary diseases,
Okay.
things like that. Yes, sir.
So some of these are kind of silent, like high blood pressure, I hear is a silent killer
Yes.
because you don't even know you have high blood pressure until one day you have a stroke or some sort of an event. Is that right?
Yes, that's correct.
Okay. And some of them, like a pulmonary disease, you know it because you're struggling to breathe, right? Are chronic diseases becoming more common, or have they always been there and we just didn't realize it?
I believe it's a combination. They have always been there, but as we move forward, people is getting, it's aging. We have new medications. People is living longer. So nowadays, people struggle a little bit more because we age more.
Okay, all right. So we're getting older, and therefore the chronic diseases that sometimes didn't manifest themselves because we didn't live long enough for them to come to manifest themselves are now manifesting themselves.
Yes.
Okay, so do chronic diseases affect men and women differently? We've had several podcasts about women and their unique needs in the healthcare space, but is chronic disease different for men and women?
Yes, they are. Some diseases affect women and men in different ways.
Mm-hmm.
Some autoimmune diseases can be more prominent in females and women. However, they can also manifest in different ways. Usually, for women, they tend to be a little bit later in life, and
Okay.
for men, they can present with different symptoms before when people is younger.
Wow, that's complex.
Yes.
Hmm. So, what sort of routine screenings should we really think about and make sure we're doing to manage? Well, first of all, to identify chronic conditions and then manage them.
The most important thing that somebody can do is actually go to see their doctors every year.
Okay,
We call
love that.
the annual physical. It's a routine screening that we do every year for all the patients. We tend to do different screenings at different ages. Some people in their 40s, they can get their colonoscopies done. For females, we can do mammogram screenings. For younger people, we can do STD screening. So it depends on your age, but it's very important to go and see your doctor every year.
Okay. So I'm going to need you to scare me here a little bit because I'm one of these people that didn't want to go see doctors on a routine basis because I was afraid they'd identify things that I didn't want to know about. So tell me why that's a really bad idea.
I think it's definitely important.
And give me a story that'll
Yes.
help connect with the dots. Because, I suspect there are a lot of people out there that just avoid a doctor because they just don't want to hear, I got high blood pressure, because that has the lifestyle changes that accompany a diagnosis like that.
So we had different cases where people don't go to the doctor because they feel well. We had a special case of somebody very young, and they decided to go for their annual screening after 20 years of not seeing a doctor.
So they're very young. They're in their 40s,
In
30s?
their early 40s, yes.
Early 40s, okay.
No symptoms, nothing like that.
Okay.
His blood pressure actually ended up being very high. High
Okay.
to close to the 200s. We have to send this person to the emergency
Ooh,
department.
200's not good.
Yeah, not good, definitely. We were able to prevent a stroke for this patient. Now this patient is on medications. We were able to control his blood pressure, and we mainly saved his life because he was very at a high risk of getting a stroke.
So I want to go to the doctor because what I don't know will kill
Yes, sir.
me.
Yes, yes,
Okay, I
yes.
get it now. I get it. Now, are these chronic diseases, just, a, a death march for us, or can they be managed successfully? Can we have a normal lifestyle with these chronic conditions?
No, we can definitely have a normal lifestyle with them. It's just a matter of going to your doctor every year, trying to find things early on in life, trying to prevent them, work on different changes on your lifestyle, check what you eat, check how many hours you're sleeping, stay away from things like cigarettes or alcohol, just making some lifestyle changes that can prevent and give you a longer life.
Okay, okay. Um, what have you heard are the biggest misconceptions people have about chronic disease? I know one was, oh my God, once I've had that, my life as I know it is gone, and now I have a new life, which scares the devil out of me. What other misconceptions do people have about chronic disease?
Yes, that is actually certainly one that we see every day where people think that if they have something, it's a death sentence. Another one is that people think that it only happens to older people, and we
Okay,
can have some symptoms, manifestation, or even nothing that we can see early in age. So we can see these type of things on any age, so anybody can have them.
okay, all right. So you and your colleagues see patients in clinic too, correct?
Yes, sir.
So, what I've heard very clearly is go see your doctor, get your baseline, and then okay, and now that even if I don't have those chronic conditions today, once I have a baseline, then my physician can tell if something changes in the future, correct?
Yes, that's
Okay.
correct.
So, Juan, given that an annual visit with your physician is so important, how do they get in to see your you and your colleagues in clinic?
Yes, that's a good question. They can find us on the website,
Okay.
on the OakBend website. There will be a list of the providers there. My four classmates plus the new four residents, as well as the two excellent providers that we have.
Okay. And so we have a QR code on the screen that you can use to get to the website so that you can make your appointments. And we look forward to seeing you again on another Cup of Joe. Have a wonderful day.